For this segment from ATS&J 2023 key takeaways, we're going to focus on sports-related concussion updates and innovation. And this was a fantastic, very detailed presentation from Diana Toto and Jason Kristofiak, really bringing to light not just some key updates, but also some really exciting things that they are doing through RWJBarnabas Health and in their roles. Real quick, Dr. Kristofiak is a primary care sports medicine physician with RWJBarnabas Health, and his areas of focus there, he's the medical director of sports medicine at Cooperman-Barnabas. He's also a medical director for the Matthew J. Morahan Center, Matthew J. Morahan III Center. He's the assistant team physician for Rutgers Athletics, and he's also a clinical assistant professor with the Rutgers Robert Wood Johnson Medical School. Diana is the administrative director of sports and rehab medicine for both RWJBarnabas Health's Cooperman-Barnabas Health Center, as well as the Matthew J. Morahan III Health Assessment Center for Athletes. So they dive into the concussions. They're living this stuff right now, and I really appreciate the two of you taking some time. And Diana, can you just share first, members of your team had the honor of presenting at the 6th Annual International Concussion Conference in Amsterdam this past year. What are some new updates that came from that conference that we are implementing and are going to be rolling out in the near future?
Yeah, so Ryan, we should expect to see the consensus statement officially come out soon. So we are waiting for that anxiously, but we can give a little bit of inside information. There's a lot of things that we're focused on. We're cognition and processing. How are we looking at some of these things? A lot of the behavioral health stuff and the mental health stuff. What are our resources? Looking at challenging, with acute concussion, challenging dual tasking and cognitive tasking, just to make sure that the processing and things is working as it should when incorporating a modified BESS or a balance assessment. And then also a sneak peek at just being ready for the SCAT-6, which is also coming soon. I know there's going to be a little bit more of a memory recall component to that, and some other things. So more to come, but we're looking forward to it.
Very exciting, and that's based on all the latest research. I know you and your team are involved with pediatric research, and you're also doing a lot of work with baseline VOMs right now, which is really fantastic. Dr. K, can you speak to that ocular motor, that vestibular pillar that is really just becoming more of a focus now than ever? Dive into this a little bit about what you shared at ATS&J, and also share a little bit about what you're doing with iSync, which is some new technology.
Sure. Thanks for having us. Great to be here. So the ocular motor pillar, extremely important for concussion evaluation and diagnosis. It's in everyone's toolkit, and if it's not in your toolkit, definitely put it there. It is so critical to be able to perform this part of the testing and a part of the evaluation. I have not seen an individual with a concussion who's not had some form of ocular motor dysfunction, whether it's acute or if there's other things going on. Like you mentioned, we are starting to see during baseline testing people with positive vestibular ocular motor testing. So the question is, are these residual effects from a prior injury? Is that just truly the person's baseline? So really critical to have. It's great to have a baseline, but if you don't, just doing it during your evaluation is again going to be super critical. iSync, great technology. It uses virtual reality goggles, kind of like Oculus, and you put them on and you can actually go through a complete vestibular ocular motor testing series. And you, as the provider, are looking at the iPad, and you can actually see what the eyes are doing. And it's really looking very precisely at what the eyes are doing as you're going through the VOMs. And it's picking up on these very, very subtle differences that are sometimes difficult or challenging for this regular, person looking at this exam. So we're finding that when we do a manual VOMs versus the iSync, that the iSync is picking up on some dysfunction that we may not be seeing in our everyday exam. So again, very, very critical for the diagnosis and management of concussion care. And it's actually really big on the rehab front. You need to know what you're treating before you're treating it.
Absolutely, and the importance that you stressed during the presentation of that sideline assessment utilizing VOMs, whether it be a modified version of King Divic or a paper version of it, or if nothing else, just simply those VOMs tests to look for an increase in symptoms or glaring things popping out. that's so crucial. And if athletic trainers out there are not implementing bombs right now, it's something that you need to dive into immediately and learn to understand, because this is something that's going to truly help us with guiding our care. In addition to guiding our care when it comes to VOMs and more effective assessment tools, Diana and Kay, you've also established an algorithmic approach to concussion care with what you're calling the Morahan CARP, CAARP. Tell us a little bit more about that and how it guides your care.
Yeah, sure. I'll jump in here, Ryan. So the CARP is the Comprehensive Academic Active Recovery Plan. It is a trademarked algorithm that, we're really proud of. But basically, it puts the athletes in tracks. It puts them in a fast track, a modified track, and a slow track. And based on how they present with their testing or their symptoms, we guide their prescription plan and their care plan pretty individualized in terms of what they can handle, what their symptom thresholds are, both from an academic and an active standpoint. So again, that can be very prescriptive and dynamic to get them back to play safely.
Yeah, it's great to have an algorithmic approach to anything that we do in medicine. Especially, it's extremely helpful for concussion care and management when you have an individual who has an extensive history of head or neck trauma, multiple concussions, modifiers, either through visual deficits, balance deficits, or a history of mood disorder. You're going to find that their return to play might be protracted. And to be able to tackle the care of that individual with a track-based approach, it allows us to say, hey, if you have X, Y, and Z, it's likely going to take you a little bit longer. That doesn't mean we're not going to be aggressive with the care and management, but we're going to be able to tailor fit the individual management plan to that very specific patient profile. So it's a very elegant way of concussion management. Of course, we're always updating things as we learn more. But again, algorithmic approach, has a very sexy appeal, right, when we're caring for our athletes.
And it's crucial because, especially for those cases where there's protracted recovery, where there's little weird things are lingering on, you have to have that algorithmic approach and make it individualized, because not every concussion is the same. And also, like you mentioned, you may have situations where it's not actually a concussion. It's maybe something else going on presenting as a concussion, and you address those and everything clears up. So thank you both for all the work you're doing in this space here in New Jersey, and the research that's happening. It's really great for our athletic trainers to be studying and to take from this. Your contact information is in the show notes. So if anyone has any questions, they can reach out to you personally. But again, thank you so much for presenting at ATSNJ 2023 and for just really giving such an impactful talk on this topic.
Our pleasure.
Thank you very much.
Thank you.
You're very welcome. Have a great day.
You too.